everyone. I'm going to talk about postpartum depression. Postpartum depression is something that is taken lightly. There needs to be a policy made for healthcare providers to assess patients during their hospital stay. Patients should feel safe and comfortable when it comes to telling the provider that something is wrong with them. Postpartum depression is usually brushed off because providers think that the mother is just tired or overwhelmed. Postpartum depression is not taken seriously unless something bad happens to the mother or the baby. This is where nursing judgment comes into play. Nurses need to worry about safety and informatics. Patients need to be safe in taking seriously when they feel as though there's something wrong with them. We have taken a vow as a provider to do no harm to the patients. Ignoring the patients, this can do harm to them and those around them. Spare or inquiry comes in place because it breaks into the evidence-based practice and is quality improvement. With that being said, I would compose a questionnaire to give to the patients before discharge and a few weeks postpartum to see how they are feeling. This will help with me research to see how I can improve the quality of life of these new moms. The healthcare providers can come together as a whole to see what is the best treatment option for the patient who is going through postpartum depression. Then once the providers have produced a plan, they can work with the patient on the plan. Healthcare providers, we want the best for our patients. The background for postpartum depression is defined as a mental health problem characterized by a prolonged period of emotional disturbance and occurring at a time of a major life change and increased responsibilities in the care of a newborn. Postpartum depression can have a significant consequence for both the mother and the family. When it comes to postpartum depression, 1 in 7 women suffer from postpartum depression. There is up to 50% of individuals with postpartum depression are never detected. Suicide accounts for 20% of postpartum deaths and is the second most common cause of mortality in postpartum women. Postpartum blues, also called baby blues, is considered an adjustment disorder of the postpartum mood disorders. It's the least life-altering. It frequently occurs in first-time mothers about 2 or 3 days after delivery and typically lasts less than 2 weeks. The detection of postpartum depression can be challenging. Depressive symptoms such as fatigue, weight change, sleep disturbances, and inability to focus are often misinterpreted as a part of the normal adjustment to parenthood, since these symptoms are common with one who is caring for a newborn. Legal factors for postpartum depression include being taken to court and being sued for not taking the patient seriously. Often, postpartum mothers feel like no one is listening to them or they're being judged. Due to not getting the care these patients need, could cause harm or death. Mothers with postpartum depression will either try to end their lives or their babies. If this happens, this could be a big lawsuit waiting to happen. When it comes to economic factors, nations with significantly higher rates of income inequality, maternal mortality, infant mortality, or women of childbearing age greater than 40 hours a week have higher rates of postpartum depression. Together, these two factors explain 73% of the national variation in postpartum depression prevalence. Political factors for postpartum depression include not having enough evidence to support the need for assessing for postpartum depression. Also, some states or faculties may believe in evaluating the postpartum depression unless someone is showing signs and symptoms for it. Some community perspectives of postpartum depression includes a lack of social support can cause postpartum depression. Domestic violence is in the form of spousal, sexual, and physical and verbal abuse can be a causative factor in the development of the disease. Smoking during pregnancy is a risk factor for developing postpartum depression. Another community perspective of someone's lifestyle. This includes eating habits, sleep cycle, physical activities, and exercise may affect postpartum depression. Vitamin B6 has been known to be involved in postpartum depression via its conversion to tryptophan and later serotonin, which in turn affects mood. The sleep cycle is among the factors influencing the risk of depression. It is evident that decreased sleep is associated with postpartum depression. Physical activity and exercise decrease depressive symptoms. Exercise decreases low self-esteem caused by depression. Exercise increases endogenous endorphins and opioids, which brings positive effects on mental health. This also improves self-confidence, increased problem-solving capacity, and helps in focusing on the surrounding environment. Lastly, when it comes to engaging stakeholder organizations can provide essential insights regarding the capacity and potential of organizations in supporting program implementation. For example, funding, endorsing, referring. Barriers and facilitators of delivering the program and routine service delivery and strategies and actions included suggested changes and alterations or proposed programs ensure of the intervention in scalable and sustainable in real-world practice. Nurses need to help new moms, even if this includes referrals and support. Nurses can help women who screen positive for postpartum depression by securing appointments with a primary care physician or clinic and by initiating referrals to hospital care coordinators and public health nurses. Further referral to psychiatric services for psychotherapy or close monitoring of psychotropic medications or both may also be needed. Nurses can also follow up by phone with depressed mothers to ensure successful engagement, appropriate treatment, and follow through. Adolescents may respond better to text messages. Advanced practice nurses with psychiatric mental health training can provide treatment in collaboration with mental health care workers. These factors support change because healthcare providers are coming together as a team to collaborate on a plan with the patient to help the patient overcome postpartum depression. The earlier postpartum is detected, the better outcome the new mom will have. Being a first-time mom can be pretty scary, especially coming home from the hospital where they have received so much support from the nurses and doctors. The detection of postpartum depression can be challenging. Depressive symptoms such as fatigue, weight change, sleep disturbances, and inability to focus are often misinterpreted as part of a normal adjustment to parenthood, since these symptoms are common when one is caring for a newborn. Some issues that nurses and providers can face are assessment and screening. Nursing assessment of postpartum involves collecting both objective and subjective data to evaluate the mother's psychological state. Given the multiple risk factors for postpartum depression, a thorough biophysical social assessment must be performed. Symptoms and clinical manifestations of major depression, along with any family or personal history of depression, should be documented. Socioeconomic barriers such as financial constraints, lack of transportation, and the lack of child care should also be noted. All maternal vulnerabilities need to be recognized to ensure family intervention and referral. A concern that when it comes to diagnosing postpartum depression is that nurses had a basic knowledge of postpartum depression, but they were unaware of postpartum blues as a different disorder and confused the two. Screening tools for healthcare settings are an important component of recommended depression treatment guidelines and of the provision of mental health services. The American College of Obstetricians and Gynecologists recommends 7 screening tests that have been validated for their use during pregnancy and the postpartum period, which are the Edinburgh Postnatal Depression Scale, the Postpartum Depression Screening Scale, the Patient Health Questionnaire, the Beck Depression Inventory, the Beck Depression Inventory 2, the Center of Epidemiologic Studies Depression Scale, and the Zung Self-Rating Depression Scale. Screening is recommended from birth to 1 year. In the last few birthing centers that I've worked at, there have not been any questionnaires done to detect postpartum depression. Questionnaires should be given at the time when the new mom are filled out the paperwork for their new bundle of joy. The only problem with doing a questionnaire is that new moms may not get the questionnaire by email or mail, but they may not have enough time to do it when they get home because they'll be too busy caring for their infant. In conclusion, postpartum depression needs to be taken seriously. Nurse practitioners can help diagnose a new mom with postpartum depression. This is where evidence-based projects come in handy because new moms can be sent out questionnaires a few weeks after being discharged from the hospital. This helps the providers produce a plan with the team and patients to see what option is best for them to be treated for postpartum depression. Where I work now as a nurse, we do not screen patients for postpartum depression. I think patients should be screened before leaving the hospital and then a few weeks after. Things can change once leaving the hospital because the new mom has all the support from the hospital staff. Given the multiple risk factors in postpartum depression, a thorough psychosocial assessment must be performed. Symptoms and clinical manifestations of major depression, along with any family or personal history of depression, should be documented. Socioeconomic barriers such as financial constraints, lack of transport, and lack of childcare should be noted. The only problem with doing questionnaire is the new moms may not get the questionnaire by email or mail, but they may not have enough time to do it when they get home because they're too busy caring for their infant. Nurses can help women who screen positive for postpartum depression by securing appointments with a primary care physician or clinic, by initiating referrals to hospital care coordinators and public health nurses. Further referrals, psychiatric services by psychotherapy or close monitoring of psychotropic medications. As I have mentioned before, sending out questionnaires to new moms to see how they are doing postpartum. New moms need all the support that they can get. By having a percentage of how many moms have developed postpartum depression, there can be change implemented before sending the new mom home. Here are my references, and thank you for listening.